It's Monday, 1 p.m., and you're here with Pospo and BRAINCAST for Mods They Learning. In fact, to be more precise, the last BRAINCAST of the year. And what a year, right? I mean, who would have thought back in December 2019 that when you were wishing your friends and family happy 2020, you were in fact taking the piss. So let's hope 2021 is going to be just a bit better, just a bit. Exactly what Professor Felix Jaka suggested to us last week, all the way from Australia. Change your diet just a bit, and your mental health will be thanking you for years to come. This Monday, though, we welcome a consultant in sleep medicine at Evelina London Children's Hospital. No, we're not going to talk about to improve the sleep of your children, though I'm pretty sure many of you would have loved that. And no, interestingly enough, we're not going to touch on his clinical activities at all, at least not directly. Though let me tell you, with studies at the University of Edinburgh, training from Glasgow to Sydney and London, his clinical career is one anyone would crave for. And no, we're not going to talk about his massive educational work on the importance of sleep and the impact of fatigue on healthcare, for which he has received several awards, but we will focus on his immense efforts and dedication to make the world a better place for everyone. BRAINCAST people, this is Dr. Michael Farquhar. Michael, welcome to BRAINCAST.
Hi there, nice to meet you. Thank you for having me.
So Michael, let's start with the basics, because to be honest, it's the basics that we take for granted, despite the fact that, sometimes we don't fully understand them. And then, of course, we end up taking them totally wrong. So what is LGBT+?
So it's one of these kind of umbrella acronyms to try and bring together different groups of people with some similarities. So LGBT plus is lesbian, gay, bisexual, transgender, and the plus kind of stands for the fact that there are people on the spectrum of sexuality and gender identity that go a little bit beyond what a lot of people's experience of that is. So that starts to bring in things like people who are asexual or pansexual, or identity such as people who are not sure, questioning. So you will see the acronym with lots of extra letters at different times, but basically it's an umbrella term to try and talk about people whose identity in terms of sexuality and gender is different to the majority, I guess.
And what's the story behind this acronym? Is it a fairly new one, or does it?
It's relatively new. So I think it first kind of started to be pulled together in the 90s as LGB to begin with. And again, the same kind of thing, just trying to bring together people with similar experiences. And then over time, more letters have been added. So the T was added first. And then, as I say, you will see it in various ways with, up to 9 or 10 letters coming after it. Wow. I think the whole thing about it, though, is that it represents a more nuanced understanding of the range and fluidity of sexuality and gender. And I think that's probably a useful way to think about it.
It is, although, using an umbrella term to include a really diverse set of people comes with its own challenges. As it risks, I think, it misses the nuances between all the different people it includes. The same way, for example, that, BME risks of, homogenizing all ethnic minorities. And, reflecting to some extent these concerns, Jack Turban, a physician at Yale in the States, who has worked tirelessly as well to promote the rights of the LGBT plus community, in one of his older interviews back in 2016, he said that, we have made so much progress in LGB health, but the T was left behind. So what do you think?
So I think that I completely agree with you. I think there are pros and cons about doing this. I think the benefits are that within that umbrella group, some groups are larger than others, and it is always much more difficult if you're in one of the smaller groups within that bigger umbrella to be able to find your voice, to advocate, to fight for rights. So by having a larger umbrella term, it brings together people who have an understanding of the issues that people like us, but who may not be quite the same as us, face, and to help support them to try and improve things for them. So I think that's the benefit. And I think there's a huge strength as well in collective identity, and that's where things like the pride flag comes in. If I go somewhere, city I've never been, and I see a pride flag flying over a pub, I'm pretty sure I'm going to get a good reaction there. So there are definite benefits. The downsides, though, exactly as you say, is that it tends to mean that the focus, if there isn't a concerted effort to make sure that the needs of the smaller groups are being attended to, then the focus becomes very much the majority. And within LGBT plus people in general, gay men are by far the majority. So there needs to be that awareness and kind of striving to make sure that it is an equal footing for everyone. But yeah, that doesn't always work as well as it should. And I think the BAME comparison is perfect. I think BAME is a really clunky term to talk about that, but it's convenient, and sometimes convenience overpowers what is right, and I think that's a problem.
You know, an older paper by Gonzalez in JAMA Internal Medicine compared the health between, I think it was something like 70,000 LGBT and heterosexual adults in the United States, unveiling substantial health disparities for LGBT adults in the United States, as LGBT were more likely to suffer from any illness and were also more likely to drink and smoke heavily than their heterosexual counterparts. And I wouldn't expect things to be totally different in the UK, especially, you know, when reading a report by the LGBT plus charity Stonewall saying that 1 in 7, that's a massive number, LGBT plus people said they have avoided healthcare treatment for fear of discrimination. And 1 in 4 have witnessed negative comments being made about them by healthcare staff. So what are the barriers faced by LGBT plus people in accessing services in the UK?
So I think that's exactly it. You kind of said it already. So there is a lack of education and awareness amongst many NHS staff in general of the fact that LGBT plus people have specific health needs. So a really simple, concrete example for that, for example, is trans men need cervical screening. But lots of people just don't put those two things together to offer that. And that then means if the screening is not offered, they're at risk of developing health problems as a consequence. So there's a huge education and awareness gap. And then once you start to address that, the problem then becomes is that unfortunately within the NHS, we know there is good data that tells us, unfortunately, that homophobic, biphobic, transphobic attitudes still persist within NHS staff. We should be better than this, but we know that the NHS isn't. And as you said, about a quarter of people working within the NHS have heard colleagues make negative statements, so homophobic, biphobic, transphobic. When you look at the experience of LGBT plus staff, they have experienced bullying and discrimination. And if you've had those experiences as a patient, well, you're not going to want to come and talk to a doctor or nurse who you think might not understand your needs and who might be actively homophobic, biphobic, transphobic against you. So that, I think that's where that 1 in 7 figure comes from. People just don't feel confident in accessing the care. And obviously, if you don't access the care when you should do, then the problem builds up, and that increases your risk of poorer health outcomes. So I think it all ties together.
And you know, things are not any better when you look into the mental health of LGBT plus people. The rare research report suggests that around half of trans young people had made at least one suicide attempt in their lives, as compared to 18% of heterosexual young people.
Yeah, so absolutely. So I think the mental health impact is a huge part of it. So being LGBT plus doesn't make you more likely to have mental health difficulties in its own right. It comes about because if you are, and you know, a lot of my work is focused on children, young people. If you are an LGBT plus teenager, just realizing that you are gay or trans, or that you're different to your peers in some way, and you don't feel confident in talking about that, you bottle it all up, you don't share it, all that worry, negative feelings, the more it's bottled up, as you will well know from your practice, that tends to make problems amplify and become more serious. So again, it's the same kind of thing. It's how society supports LGBT plus people, and the lack of appropriate support then increases the risk of mental health difficulties. And exactly as you said, when we look at the data at any age, but you know, I happen to work predominantly with children, young people, but when we look at the experience of LGBT plus kids and teenagers in school, they're far more likely to be bullied, they're far more likely to have episodes of self-harm, they're far more likely to try and kill themselves. And exactly as you said, where that is bad for LGBT kids, it is much worse for trans kids and young people, and it needs to be a focus, I think. There's one other thing, so I'll shut up in 2 seconds. I think one other really important thing about that taes in, and I think it will come on to something you're going to talk about later, is that for many LGBT plus people, the concept of found family is really important. That actually for lots of LGBT plus people, their support comes from finding other people like them. And again, that comes back to that umbrella and why it's so important. And if you can't find that family to support you in the first place, then your risks of these problems go up.
And it seems that, you know, things are not easy, even for LGBT plus healthcare professionals. So the British Medical Association, you know, they published a report aptly titled "Discrimination in the Workplace or Place of Study," the experience of lesbian, gay, and bisexual doctors in the NHS. And the results, I have to say, were not that encouraging.
No, they're not at all. And it goes both ways. So if you are an LGBT plus member of staff and you hear a colleague making a homophobic, transphobic comment about a patient, well, you're not going to feel confident in being your whole self at work. And we know in whatever you're thinking about, if you're not able to be your whole self at work, then there are consequences of that. The reports that you've already mentioned, so as well as talking about the experience of patients within the NHS, they talk very much about the experience of staff, and significant numbers of LGBT plus staff just don't feel comfortable in being out at work still in 2020. Those who have experienced, about a quarter will have experienced homophobic, biphobic, transphobic comments. Many will have experienced bullying. And then again, these problems amplify, because if you feel like the environment around you is not supportive, if you think that this is just accepted as the norm, that these attitudes are tolerated, well, then you don't feel comfortable in talking up and speaking up and saying this isn't okay. So again, people just tend to bottle it all up, and it's a big problem. I think so there's lots of efforts being done to try and tackle that. The scary thing, so 10% of people within the NHS still think that being gay is something that can be cured by conversion therapy. There are healthcare workers that think that is acceptable still. That's terrifying.
And Mike, as if things, were not, hard and difficult enough, then comes the pandemic. And reading through a survey by the LGBT Foundation, called "The Impact of the COVID-19 Pandemic on LGBT Communities," it seems that the LGBT community didn't have it easy during the pandemic. In fact, the mental health crisis calls had increased by 123%. Calls about abuse by 86%, those about domestic violence by 65%, and substance misuse by 50%. So my question is, what were the particular difficulties the LGBT plus community faced during the pandemic over and above the rest of the population?
So I think it's an amplification of the vulnerabilities that are already there for LGBT plus people. So, and again, so that's where that concept of found family is important. If your support comes from people, friends rather than biological family, and then suddenly the pandemic rocks around, we're all locked down, you might be, forced to stay just in your house, you can't see people and all the rest of it, you lose that normal support. Many people, unfortunately, are still living in households where they are not in a supportive environment. So, so if you are living with family members who are not supportive of you being LGBT plus, where previously they could have escaped for periods of time, and suddenly they're locked up in a pressure cooker. And I think that ties into things like domestic violence and things going up in terms of all that. But I think very much it just amplified the problems that the pandemic in many ways has been like a pressure cooker in terms of taking tensions and inequalities that were there before and just really amplifying those and building them up. And I think that's where the main problem has been. There's been, again, some of the shared things, so lots of people have had difficulties in accessing clinics. So, so if your clinic appointments are cancelled, then, your healthcare suffers. So there's a lot of the general impact of the pandemic also had an impact on LGBT plus people. But I think it's that increasing feel of social isolation. We know that more LGBT plus people on average, particularly older LGBT plus people, tend to live alone. So, I think we were a more vulnerable group to begin with.
Okay, so let me be just for 1 minute, I'm going to be devil's advocate, right? So a report by, I like that role, for some reason I like it. So a report by the LGBT Foundation suggests that 64% of the LGBT respondents said that they would rather receive support during this time from an LGBT specific organization. So my question is, are we compartmentalizing healthcare that way? Or not?
I think we need, so I think yes and no, to be perfectly honest. So I think, if I could click my fingers and solve this problem in one fell swoop, it would be by, improving education and awareness and having the NHS being an open, a responsive, an understanding environment for LGBT plus people, but it isn't, and we know that. So I think at the moment it makes perfect sense. If you're an LGBT plus person, particularly if you're one of that 1 in 7 that doesn't feel comfortable coming to the NHS, then you need to be able to access organisations that are going to be able to give you that support. And the LGBT plus Foundation, whose report you quoted, are very active in that. There are organisations like Switchboard, which provide specific mental health and other support to LGBT plus people. And I think that's really important. But I think we also need to be saying, look, should these services, should they need to exist? Shouldn't we be providing this within the NHS? Shouldn't we be better? And absolutely we should. And clearly there's work going on around about that. Within the NHS, I think there is then a role for some very targeted and specific NHS resources, and again, particularly for those groups who we know are most vulnerable and suffer the most from health inequities within the NHS. So Clinique, for example, is a clinic that operates not very far from you at King's, which provides specific support to trans people in terms of their healthcare. And I think that's a very valuable resource. In an ideal NHS, it probably shouldn't exist. We should be able to do this within the umbrella of the whole NHS, but we can't, so we make compromises and we build to something better.
You're right, you're right. And then, there are pronouns. So going through social media, it is really common nowadays for people to end their profiles with their preferred pronouns, he, him, etc. So why is that important?
So I think people forget what pronouns actually are. Pronouns are a marker for our identity. They're the words that we use instead of using our names. And if I was to keep calling you Jim all day, you would get really annoyed at that and fed up because it's not your name, it's not your identity. And there are people who are trans, people who are non-binary, may use different pronouns to represent their identity compared to what people might think they do. So it's really important to get that right, because every single time somebody hears the wrong pronoun being used to describe them, it's like me calling you Jim. It's the wrong name, it's the wrong way to define your identity. But it can be really difficult for somebody in that position to stand up and say, look, I want you to use the right pronouns for me, because all the reasons we've already talked about, they may not feel they're in a supportive environment. So the whole point about identifying pronouns as a kind of a routine thing is to normalize that conversation. So my name's Mike, my pronouns are he, him. It says it on my little hello, my name is badge here. It's in my email signature. And to most people, they'll kind of look at it and go, oh, what's that about? But to the people it really matters to, they see that and they think, right, okay, that means I can put my pronouns in, and it begins to open up that conversation. And it's that umbrella concept. It's people like you or me using our position, our privilege, to support people who don't have that same kind of power to do that by themselves, and trying to help make everybody's life a little bit better. Such a simple thing to do. Why wouldn't you?
Amazing, simple yet powerful. You're right, you're right. But relevant to pronouns, I have witnessed, I have to say, many awkward conversations on the wards, with nurses and doctors, sometimes, walking on eggshells when treating a transgender patient. So does this reflect, a gap in our training or our education?
Yes and no. So yes, I think it does. And as we've already said, I think there is a significant gap in terms of the basic information in terms of education and awareness about LGBT plus people. And I think we do need to be building that in, absolutely. But I think the bit that people always forget about this, and this is where the answer is no, is that I think people get very worried by the specific situation, and then they don't apply the general principles to how we deal with anything in medicine and healthcare. If I make a mistake, and it's an honest mistake to a patient, I say, look, I'm really sorry, I've made a mistake, shouldn't have happened. I apologize for making the mistake. What can I do to make sure it doesn't happen again? And 9 times out of 10, that immediately diffuses the situation, and actually you build a better relationship with the vast majority of patients and people by being all open and honest when you've made a mistake. If you try and cover over the fact that you've made a mistake, even though it's obvious you have, and then you just keep barreling on, then everybody feels more uncomfortable. So, we're all trained to do that. We make a mistake, we own up to it, we apologize, we work out how we can do it better, we move on. Exactly the same thing should apply in these circumstances, I think.
So let's focus on children now. So how often do pediatricians see children considering, gender reassignment in their practice?
So not very often, and I think partly because many pediatricians, I think, will see trans kids and young people in their clinic without realizing that they're trans. It may not be something they disclose to them, and that's where things like the rainbow badge are important, because it means that people can. I'm a sleep physician, so it's not my area of practice, but I've certainly seen several trans young people coming through my clinic over the last few years, and often because when you are a trans teenager and you are dealing with living in this country as a trans teenager, which is horribly stressful experience. You're on a 3-year waiting list to get seen by the gender identity clinic. You know, there's no positive support from media and all the rest of it. Then you're going to be anxious and stressed and worried. And when you're anxious and stressed and worried, you're going to have sleep problems, and you end up in my clinic. So I certainly see them, colleagues do, but I think there's often a lack of awareness and understanding. I think, again, people feel nervous about it and, you know, think they're going to make mistakes, so they just don't want to talk about it. And again, I think we should be much more open. The more we talk about these things, the more that we can provide support, and actually just validating who they are is a hugely important part, I think. And it gives them confidence. If they come and see Joe Average sleep doctor, and I'm able to be aware of, you know, their identity, to affirm that, to support that as part of our routine practice, well, actually that gives them much more confidence the next time they come that they're going to get good care. So I think it's really important on that level.
Things, though, are not as straightforward. I mean, the UK's only NHS Gender Identity Development Service, GIDS, and they are under the Tavistock, if I'm correct. So they have helped many children over the years in this process. However, there has been much controversy over the use of puberty blockers. Now, for people not familiar with the term, so puberty blockers are prescribed to some children who are experiencing gender dysphoria to temporarily stop their body developing. But it was only recently that a 23-year-old woman took legal action against the clinic, saying that they should have challenged more by medical staff over her decision to transition to a male as a teenager. So what are we missing?
So I think the way that I look at this is by looking at the care that we provide to trans and gender diverse children and young people in the UK compared to other comparable countries. And when you look at the way that these kids and young people are supported in countries like Australia, New Zealand, America, we are very different, I think. Our guidelines are behind international guidelines, and there is a very toxic environment in the UK in general at the moment, particularly over the last few years, that has built up around about trans people. And I think that then becomes the filter through what so much is seen. Some of the statements that were made in that court case, so, you know, that this is experimental therapy, you know, you jump across to Trump's America, and the, you know, the US Endocrine Society says that this is established treatment. They're not talking about it. It's you know, long-standing. We know that using puberty blockers appropriately in young people experience significant gender dysphoria who are likely to then have significant worsening of that if they go through gender incongruent puberty, significantly improves their mental health. So, you know, there is lots of good evidence and good guidelines that tells us that we should be able to use these appropriately. And I think what it tells us, you know, so rulings like the High Court ruling, I think there's a lot to, you know, as I'm sure you'll know, it's being appealed, and I think there's a lot to unpick with that. But I think the most important thing is it tells us is that the UK is an outlier in terms of providing healthcare and support to trans children, young people, and adults. It's a horribly toxic environment in the UK compared to most other countries, and I think that's something that we need to urgently look at why and address.
I mean, in a recently published systematic review by Claire Wilson, so they were looking into the qualitative research of LGBTQI plus youth and mental health. So they suggested the community, the school, and the family resources to support resilience will optimize LGBTQI plus mental health. So it all boils down, just reading that, it all boils down essentially to being, you know, human and understanding in the end. But it's not as simple as it sounds, right?
It's not, but I think you're absolutely right. So that kind of social support is hugely important. Again, so I think that applies across the whole of the LGBT plus spectrum. But again, if you look at supporting trans children, young people, social affirmation, social transition is hugely important in protecting the health and well-being of those children, young people. And the better that we do social transition from as early as they want and support them and affirm, the more likely they are to have good outcomes. I think that ties into a much wider kind of theme, though, which is that for all of us, social normalization is absolutely essential. You know, so I grew up in Scotland in the 80s. I remember EastEnders when Michael Cashman's character did the first gay kiss, and it was a really innocent peck on the lips. And the next day, the Sun's headlines were, you know, get this filth off our screens. You know, this shouldn't be shown before the watershed. You know, so that kind of toxic attitude towards people like me really affected me growing up. You know, I didn't feel safe in any way to say I am gay until I was really quite old, to be perfectly honest. So social normalization is really important. We have to be able to normalize the fact that there is a diverse spectrum of sexuality, of gender identity, and that nothing, you know, nothing is right, nothing is wrong. Everybody's just different and normal. That's really important. Education is absolutely essential to that. Campaigns to get education about LGBT plus people into schools, hugely important. The Thai campaign in Scotland have done massive amounts of work on this. And it's not about, you know, so all the protests outside the schools are, oh, we can't teach 5-year-olds about gay sex, how that's disgusting. And actually all it's doing is saying, look, little Timmy in the class who's got 2 mums comes from just as normal a family as the kid with a single parent or the kid with a mum and a dad. You know, there are lots of different normals, and that's what's the important thing to get across, and that makes everything better. So I think that role of community, of school, of media is hugely important in normalizing, and that builds that resilience that you're talking about. Found families, again, you know, it's you pick the people that support you.
And, you know, mindful of all the issues and challenges faced by young people who identify as LGBT+, particularly when accessing NHS healthcare, you took it upon yourself to raise awareness. So what is a rainbow NHS badge scheme, for which, in fact, you know, you were awarded the Individual Guys of St. Thomas's Trust Award in the Respecting Others category in recognition of this work?
So really simply, all it's meant to be is, you know, so somebody wearing a badge like this, all it's meant to do is to symbolize that I am a good person to talk to about issues related to sexuality or gender. That's all. I am somebody who hopefully has a bit more education, a bit more understanding. And if somebody comes to me and tells me something and I don't have the answer, well, I'm going to help you find the answer. It's all about giving people that confidence to tackle the fact that we know that people don't feel confident accessing healthcare. It's about making people feel secure and doing it. So it's just, the power of little visual symbols is, I think, often underestimated. But you know, the feedback we've had, some of the patient stories from and clinician stories about how these have started conversations that otherwise would not have happened. And I think, you know, so you were talking about being kind, being the core of being clinicians. I think conversations are really at the heart of that. If we don't talk, we can't do anything. So that's all this is. It's, you know, you can talk to me, basically.
And what's the next big challenge for the LGBT plus community, in your opinion?
So I think we have a huge task ahead of us in terms of both defending the rights and, you know, the positions that we have already managed to achieve, and establishing rights and position for those that don't yet have it. I think there are some really concerning signs. So Justice Amy Coney Barrett, Trump appointed to the Supreme Court, has connections. She's received funding from an organization that believes that homosexuality should be made illegal in the United States again. There are huge pressures on rolling back rights that have already been won. Trans people, again, so a lot of the rights that LGBT people have fought for and won over the last 30 years in many countries around the world, trans people still do not have. So we need to be focusing and supporting them. They've always supported us. We need to support them, that umbrella, you know, that make sure they get their rights. On the international stage, there are 25, 26 countries where equal marriage is now legal. There are 70 countries where homosexuality is illegal. There are 12 where homosexuality carries the death penalty. We are seeing across the European Union, so LGBT plus free zones are being developed in Poland. We are seeing regression of things that have been fought and won for. So that, I think, is the focus. We have to keep an absolute razor sharp focus on what we've won, what we had to do to achieve it, and what still needs to be achieved. Pride is a protest, and it still needs to be a protest to carry on fighting.
And in one sentence, what do you wish for 2021?
In the UK, a comprehensive overhaul of services for trans and gender diverse children and young people in particular, but trans people in general. 3 years waiting list to see somebody in a gender identity clinic. It's far too long when you're a trans teenager struggling with all that can entail. So that's what I want to see.
BRAINCAST people, Dr. Michael Farquhar. If you aspire to be one doctor, that would be him. Okay. And a bit of me.
Definitely not.
Minus the Greek accent. Thank you all so much for being part of this journey, because the truth is that, you know, without you joining every week, I would just be talking to myself. And although this sometimes can be fun, most times it's better to have someone listening to you. Thank you to Dr. Tom Pollack and Jonathan Rogers that one morning in March, they came to my office saying they wanted to do something about the psychiatry of COVID, and boom, this is how BRAINCAST was born. Thank you to Consultant Connect for supporting the first 5 sessions, and of course, the Monster Learning Gang, Gareth, Katie, Magic, Caroline, Sean, for allowing me to do whatever the hell I want to do using this platform. Most importantly, a massive thank you to all my guests that generously gave their time. No, they're not being paid. Nobody's being paid for this. Not me, not them, not anyone.
Now you tell me.
Yeah, it's all it's all about love. And on that note, enjoy the festive season regardless of your weight, height, color, religion, or lack of. Regardless if you're two men, women, or both, or none, who cares? If you're from this side of the ocean or the other, or even if you're an intergalactic traveler that just came to visit this bloody planet to finally see what the fuss is all about. I will see you all on January 18 with Professor Louise Howard, a professor in women's mental health. Sounds interesting already, right? Until then, Pospo and BRAINCAST for Monster Learning, over and out.